Good day, everyone. I'm Dr. Azura Muhammad Afandi, consultant dermatologist from Hospital Kuala Lumpur. Today, I'll be walking you through practical severity assessment in generalized pustular psoriasis, focusing on two key tools, which is a GPPGA and GPPASI. We'll go through real case-based examples so that by the end of this session, you'll feel confident applying these scores in your daily practice. Let's start with GPPGA, or Generalized Pustular Psoriasis Physician Global Assessment. If you remember from previous presentations, GPPGA assesses three components. It's a very simple, clinician-friendly scoring system. For the pustule score, it ranges from 0 to 4, where 0, there's no visible pustules. 1, it's almost clear, there's only low density, occasional small discrete pustules which are non-coalescent. For score 2, they are moderate in density, grouped discrete small pustules which are non-coalescent. For moderate score, it's high density pustules with some coalescent. And 4, there's very high density pustules with lakes of pustules. For erythema, it also ranges from 0 to 4. 0 when there's nothing, no erythema. 1 when there is faint or pink, slightly red. 2 light red. 3 bright red. And 4 deep, fiery or dusky red. For scaling, 0 there's no scaling or crusting. 1, there's only superficial focal scaling or crusting, which is restricted to the periphery of the lesion. 2, predominantly fine scaling or crusting. And 3, moderate scaling or crusting covering most of all the lesions. And 4, when there's very severe scaling or crusting covering most or all of the lesions. So once we have determined the scores for all these three components, you will get the composite mean score. So you have 3 scores divided by 3, so you will get the composite mean score. And depending on what the score are, you will get the GPPGA total score, which ranges from 0 to 4, from clear, almost clear, mild, moderate to severe. What about Generalized Pustular Psoriasis Area and Severity Index, or GPPASI? So this is a little bit more complicated, but it's not difficult to do. It's actually adapted from PASI, but modified for GPP, and the thickness is replaced with pustule score. So similar like PASI, it assesses first the extent of involvement, where the score similar to PASI, ranges from 0 to 6, depending on the percentage of involvement. And we assess 4 anatomical areas, which is the head and neck, the trunk, upper limb, and lower limb. And for each area, we will give a score for erythema, pustules, and also scaling or desquamation. Each area are weighted depending on the area. So for head and neck, it's 0.1. Upper limb is 0.2, trunk 0.3, and lower limb 0.4. Now, let's apply both tools in 2 cases that I have prepared. Let's start with case 1. As we go through this case, I encourage you to think actively and try to score along with me. We will calculate the GPPASI and then the GPPGA. Let's start with this first patient. So if you look at these photos, starting with the head and neck region, you can see that the face is clear, apart from a few plaque psoriasis on the forehead. However, the neck is very much affected. Okay, you can see the coalescing pustules. So ask yourself, what percentage of this area is involved? How severe is the pustules, erythema, and scaling? I hope you agree with me. For erythema, I will give it a score of 2. Pustules 3, because they are very dense pustules, but there's no lake of pustules. Scaling is really very minimal scaling, which gives a score of 6. For the area, I would rate it between 10 to 30%, which gives a score of 2. So 6 by 2 is 12, and the weighted area is 0.1. So it gives a score of 1.2. Now let's move to the trunk. So this region has a higher weighting, so it contributes significantly to total score. So pay attention to this very confluent erythema, so very dusky looking, and he has very dense pustulation. As you can see here, there are lakes of pustules and moderate scaliness, quite extensive, but I wouldn't say that it's very severe scaliness. So for this patient, I would score erythema and pustules as 4 and scaliness as 3, total 11, and since it's a very extensive area, I would give it a score of 6, which is it's definitely more than 90% of the trunk area, which gives a total score of 11 times 6 is 66. The trunk is weighted at 0.3, and the total score for trunk is 19.8. Next, the upper limbs. We should assess both sides collectively, and you can see here it's very extensively involved. You can appreciate the dusky erythema, and if I close up photo of the arm area, you can see there's lakes of pustules, very dusky, almost purplish color erythema, and there's moderate scaling. So for this patient, I would score erythema and pustules as 4 each, scaling of 3. So it gives a score of 11. And for the area, it's quite extensively involved, between 70 to 90% of the arm surface area. So which gives a score of 55, and the arms is weighted 0.2. So the total score for the arm is 11. Finally, let's look at the lower limbs. Again, this region carries significant weight. So if you look at the color, again, it's very dusky erythema. There are lakes of pustules, but not so much scaling. So for this patient, the erythema and pustules get a score of 4 each, scaling 2, total of 10, and the area I would put as 3, between 30 to 50% of the lake surface area. So total will be 10 by 3 is 30 times 0.4, which is the weighted area for lower limbs, which gives a score of 12. So if we calculate, after we sum up all the regions of the head, trunk, upper limb, and lower limb, the total final GPPASI score is 44, which indicates very severe and extensive disease. Now, let's calculate the GPPGA for the same patient. So this is much simpler. So I decided to go through GPPASI first because it's more complicated, but GPPGA is simpler. So you just look at the patient as a whole and assess which area that represents the patient as a whole. So for this patient, I would grade the pustules as 4 because, as you can see, he's got a lot of area with lakes of pustules. The erythema score is very dusky, very inflamed. It's almost purplish in color. I would give a score of 4. Scaling, some area they are very scaly, but some not so scaly. But we would take the majority, the area, I would say on the trunk is the most severe area. I would give a scaling score of 3. So give this, the composite mean score will be 3.7, which makes the GPPGA score of 4, which is severe. Now let's move to case 2. This is a 40-year-old lady who's had GPP since 10 years ago, and she presented with GPP flare with increased white cell count and increased CRP. So you have to remember that GPP is a systemic inflammatory disease. It's not just cutaneous disease. Always look for the systemic symptoms. If we want to score the GPPASI for this patient, look at the head area. You can see that it's pretty clear. So the head area, we get a score of 0. What about for the trunk? So now it's definitely less severe than the first case that I shared. And if you look at the close-up of the lesion here, it's mainly annular. It's bright red, but very minimal pustules, you can see here, and the scaling is limited to the periphery of the lesion. For this patient, I would score the erythema as 3, both pustules and scaling as 1, so total 5. And since the area involved is definitely less than 10%, it gets a score of 1. So 5 times 1 is 5. And weighted score for trunk area is 0.3. So the total score for trunk area is 1.5. Next, the upper limbs. You can see this is the right upper limb. It's bright red. Okay, if you can see the close-up photo here. So the pustules, they are moderate. Some are coalescing. Scaling is limited to the periphery of the lesion. This is on the left upper limb. This is a close-up photo where you can see areas of legs of pustules. There are more dense pustules in this area, but not so much scaling, and erythema, I would say, is probably 3. So for the upper limbs, the erythema gets a score of 3, pustules 4, scaling 1, total of 8. And area, I would score it between 30 to 50%. So 8 times 3 is 24. And the weighted score for upper limb is 0.2. So the total GPPASI score for the upper limb is 4.8. Finally, the lower limbs. You can see there's quite extensive involvement of both lower limbs, covering about, I would say, 70 to 80% of the lower limbs. And on close-up view, you can see the color is very bright red, almost a dusky color, with lakes of pustules, but the scaliness is limited to the periphery of the lesion only. So for the lower limbs, I would score erythema as 3, pustules 4, scaling 1, total of 8. And since it's a quite extensive involvement, I would rate the area 5, between 70 to 90%. So subtotal is 40. And the weighted score for lower limb is 0.4. So the total score for this patient is 22.3, which is moderate to severe disease. What about the GPPGA? So once we have done the GPPASI, GPPGA is very easy. So pustules, there are legs of pustules, so that gets a score of 4. There's bright red erythema, so the score is 3. Not so much scaling, mainly on the peripheries of the lesion. I would rate it as 1. So the composite mean score is 2.7. So the GPPGA score is 3, which is moderate disease. So in summary, GPPGA is simple and fast. It's useful for clinical monitoring, and it can be done quickly based on 3 components only. GPPASI is more comprehensive. It incorporates the extent and severity of the disease. It's better for clinical trials and detailed assessment. Remember to always interpret scores in clinical context. Don't forget the systemic symptoms, laboratory markers, and patient well-being. It's very important to assess the severity of GPP early, as this helps to guide timely escalation of therapy. I hope this session has helped make GPP severity assessment more practical and approachable for your daily clinical work. Thank you for your attention.